So I think someone's been desperately trying to get a question in.
I just want to thank Dr. Greenspan for bringing up some of the mental health issues, because my interest is in informatics and psychiatric care, and specifically in the integration of medical care and psychiatric care. I think there's a lot of good for that. A lot of people with mental health difficulties often have a lot more medical problems as well. So I think that there's a good potential cost savings if we're able to integrate those two things. The problem I found is most of the electronic health records that I've seen are more based on, it's like a medical surgical workflow as opposed to the workflow in psychiatry, which is very different. So I just want to ask if any of you have any experience on specifically in the use of informatics in psychiatric or mental health care.
But one of the interesting and I think unfortunate things is, and you pointed out very rightly that medical problems, mental health issues are very closely tied together, and you can rarely cure one without treating the other. One of the challenges, back on the policy front, is that very often mental health information is treated differently from other information. There are certain pockets of certain walls built around different types of information, whether it's mental health issues, whether it's HIV status, other things of that nature, which makes analytics and other things more challenging. I think the other thing we're seeing has been this, in some ways maybe a byproduct of our policy about implementing electronic health records is, back in the day when people were building electronic health records, there was a psychiatry-specific EHR, there were ophthalmology-specific EHRs, and everyone had a little niche that they were doing. As we moved into, through the Bush administration with the call for electronic health records by 2014, and we moved into meaningful use, there's been an issue of we need something that fits the whole hospital. And so mental health has that issue. Pediatrics has that issue. You go to pediatric hospitals, they're like, how, we've got to get a certified application that will talk about the issues that are related to adult patients, and we've got to implement this stuff. We've got to show that X% of our orders related to this or information related to adult patients, works here. So, as Carrie pointed out, policy is a pretty blunt instrument, and there are unintended consequences left and right related to what specific needs get addressed or don't get addressed.
Yeah, and I would add as well, I think behavioral health in particular hits right to the core of what the biggest problem we face in health IT right now, and that's structured versus non-structured data collection. And, as an ED nurse, I will take a mental status exam, which has behavioral health components. It's structured behavioral health data, and that's a subset of what I do in the emergency room. But behavioral health practitioners tend to focus more on non-structured, more of a narrative note. And that gets to my point earlier about the patient's story. We have not really done a good job of being able, through our electronic health records, and I would argue our paper records as well, at being able to sort of discern what the patient's story is. And nowhere is that more complicated than in behavioral health. So I think the answer to your question is we need to do better, particularly with non-structured data collection, whether it be through voice recognition technologies or other types of technologies that we can use to better address the issues of a narrative note and incorporating that data into the electronic health record.
To make it concrete for people, I did some of my training in London, and for a mini mental status exam, they'll ask, what's your name, where are you, who's the president, kind of stuff. And when I was in London, one of the questions on the mini mental status exam was, who is the Minister of the Exchequer? It was a hard question for me to answer at the time, and so I was actually labeled as somewhat comatose. And that's the problem we face of trying to pull this analytics data, because we have very different fields pulling in, and how do we normalize information to get valuable stuff out of it? And I think it's been I hate to say this, yet another big challenge we have to face, but is it another big challenge that we have to face of understanding what those things are? The other thing is, we talk about big data and the use of big data. Healthcare data has historically been very, very dirty, part of it is, we barely can even tell what patient we're talking about. Are you John Smith? Are you John Q. Smith? Are you J. Quinn Smith? Which patient is it? Even with the VA and the Department of Defense, which have very elaborate electronic health records, they have a lot of problems matching individuals, and just identifying with health information exchange
what patient you're talking about. Forget the individual information there. Are we talking about the same individual? Can be a huge challenge.
I think if you look at other countries that have successfully managed mental health, unlike the U.S. is far behind, I think, from a facility standpoint especially, but Canada, and I know in Turkey they have an extensive medical record and a lot of focus around mental health, and so there may be, aside from policy, there may be ways that these things have been implemented in other countries.